Well, by the laparoscopic procedure, I presume you mean that the fallopian tubes were removed maybe because of hydrosalpinx and blockage. If that's I'll answer every option. If that's the case, I think you can have your embryo I think I would personally wait 3 months until you know there's no more toxic effect of the drip of accumulated fluid in the fallopian tube down into the uterus. Just make sure all that is over with and gone. Furthermore, before doing the embryo transfer, I would do an endometrial biopsy, which we sometimes call a scratch, to make sure that you don't have endometritis and need antibiotics before the transfer. Because the embryos are precious, and you just want to make sure that you have maximum receptivity that the tubes could prevent. Now, I see another question. What's the difference between laparoscopic and hysteroscopy? Hysteroscopically, you're just looking into the uterus, and if there's a polyp, you certainly do it hysteroscopically right through the uterus, no surgical incision, nothing like that. And then you just remove the polyp. If you have a fibroid that is actually inside the uterine lining, well, then you would shave it off, and it might take several sessions of hysteroscopy to do that, but you avoid an open operation. It's better. But now, other surgery, laparoscopy, means you're going through the belly button, so to speak, and you're going into the abdomen and you're operating from above. And so typically the tubes are removed laparoscopically, but a polyp is removed hysteroscopically. So hysteroscopy is a piece of cake. Laparoscopy is more invasive. Now, if it's really truly a fibroid uterus that requires that really requires a surgery through the abdomen, the FDA doesn't recommend laparoscopy or robotics, and nor do I, though people do it. I think you can do a much cleaner job with those fibroids with a mini laparotomy. I could explain the technical details why, but I think it's just much safer than removing and shredding up fibroids through the laparoscope. And when they do that, even the best laparoscopic surgeons miss fibroids. Whereas if we do it with a mini laparotomy, we're not going to miss the fibroids. So that's a long answer to the difference between laparoscopy and hysteroscopy.